It is health that is the real wealth and not pieces of gold and silver. Good evening and welcome. This is Face the Nation. Our topic of discussion today is COVID-19, lessons learned and advice for the future. We've invited four of our usual players who come on the show and keep our viewers abreast on the new developments of COVID-19 this time around as well, given the fact that 4,000 individuals are now infected on a daily basis in the country and the number of death toll stands at 198 as of the daily count as of yesterday. So to discuss all this and more, we've invited four guests to our studio this evening as well. Joining us this evening on the show are Professor Atul Sumantipala, Chairman, National Institute of Fundamental Studies and Emeritus Professor of Psychiatry, University of Kiel, United Kingdom. Dr. Rajiv De Silva, immunologist, media spokesperson of the Association of Medical Specialists. Professor Indi Karunatilaka, former president of the Sri Lanka Medical Association, as well as Dr. Miru Chandradasa, consultant and child psychiatrist, Ragama Teaching Hospital. So let's start off tonight's show with Professor Indi Karunatilaka, former president of the Sri Lanka Medical Association. Professor, as we speak now, the number of infected people due to COVID stands at 4,000 on a daily basis. We have the number of deaths increasing to 198 as of yesterday on a daily basis again. Are these numbers understated, or do you think there should be a sharp rise in the numbers despite a lockdown has been imposed? The time starts now.
Yes, what you have mentioned are the official figures that are stated daily, but there's another side of the story that you have to look into. If you now there may be some say concerns about the actual number, and when you get the official figures, sometimes the actual figure may be more than the official figure because there are some deficiencies in the data flow from the ground level to the final report. There may be some delays and there may be some deficiencies that were well discussed. So, I mean, without going into details, official figure is there, but the actual figure may be an underestimate, and that can be assumed in many ways. One thing is when you look at what's happening in the hospitals, the current hospital system or the health system is overflowing. Previously, there were about 30,000 beds that were allocated for the COVID patients, but that number was not adequate. Now it is increased to over 41,000. Even that number is not adequate because at the moment, many doctors around the country, they will find it very difficult to admit a COVID patient, a necessary COVID patient to a hospital, whether it's a government sector or the private sector. And when you think about the number of oxygen-dependent patients also, the number of those patients who are getting maybe bad is higher than the previous number. Previously, most of the patients who were admitted to the hospitals were asymptomatic. So if you get these figures, then probably the actual number should be more than what is officially declared. That is one. Another thing is when you go into the current situation where the disease is spreading so fast, and sometimes when one member of the family gets tested, other members might not get it tested because of the difficulties at the moment, and the testing is also very limited. Currently, the country's testing capacity is also limited, but at the same time, they get symptoms. So in that case, only one person in a family will get tested positive and might get included into the national system, into the data system. That also might not happen. For example, sometimes there may be people who are getting the testing from private laboratories, and that might not be reported directly to the national system. As I have mentioned, there are several deficiencies in a database, the data flow system in the country. I am telling that not to put fingers on anyone, or basically not to put the blame on anyone, but that deficiency was there. So that was one reason why this underreporting was happening. Now, in a practical example, just say a person in somewhere in the Hypoxia getting a PCR done today and maybe this morning, and then the MOH entering that into maybe a piece of paper, and then forwarding that to the maybe the regional epidemiologists, and from there onwards the data may be converted into a maybe electronic system and sent to the epidemiology. So there's a data flow, and there are many points that the delay can happen. Even what we call about the positive rate, the test positive rate of PCR. Now the test positive rate is simply calculated by the number of PCR done today, that's the denominator, and what was number positive. So obviously that's very simple. But when you look at the real picture, the number of positive that you get today are not necessarily the number of positives PCR that got positive today, because there can be delays. And the denominator can be the PCR that was done today, but the numerator could be different. So due to all these reasons, there may be discrepancies between the official figure and actual figure in the field.
Professor Indika, when these statistics are released by the government, do they also take into account the rapid antigen tests that are being carried out as well? So this is a culmination of both?
Yeah. Currently, both are taken into account. Now, previously, some time ago, it was only PCR, but later the rapid antigen was added. So when you talk about the positive, then it's a combination of both PCR as well as rapid antigen.
Right. Professor Indika, you speak about several deficiencies when releasing data to the public, but I want to drag your attention to the vaccination program of the government itself. How logical is this program? Because we see the manner in which vaccinations are being brought from the US, vaccination was brought from Belgium, the Pfizer vaccination, the Moderna vaccination was brought from the US. But what is the mechanism or the rationale behind sending out these vaccines to certain parts of the country? What is the thinking? Because I don't understand. I want to know whether you understand.
Okay, so what you have to see here is the combination of the logistics and the scientific basis and the decision making. When initially, even before the vaccines were brought to Sri Lanka, there was a very clearly laid out plan. That was what we call the vaccine rollout plan, that was prepared in collaboration with the Ministry of Health as well as the WHO, which was very scientific and very rational. And the rationale behind that is that no country will be able to provide the vaccination, immediate vaccination, to reach the herd immunity of say 90 levels or so. So the amount of vaccines available is limited. So the idea of the vaccine rollout plan was rationalized. And that rationalization, the basis was first to provide the health workers or the health professionals who are working in the front line who have the highest exposure. Then secondly, to the armed forces and military, again, who are working in the front line. And thirdly, it was for over 60 who are with comorbidities. So that is based on the understanding that the supply was limited. And initially, the adherence was there. But as time went on, there was some deviation due to several reasons, and now it has gone beyond control. So that, I think, that has led to some of the maybe the errors, or might have been maybe mistakes or deviation that has happened due to vaccination.
Because I'm asking this question from you, why, Professor, when you take a look at the number of deaths, do you think if there was a systematic system in Sri Lanka to vaccinate individuals, would have this number reduced, or would things improve for the better?
Okay, it's always very easy to look back and say this could have been happening that way. But having said that, yes, if there was a clear adherence, if there's a clear adherence to the initial vaccine rollout plan that gave the third priority to those above 60 and comorbidities, we might not have seen what is happening today. Because when you look at the deaths that are happening at the moment and the percentage of deaths over 60, over 70, and those who have taken the second dose of vaccine and others, then the data really clearly points out that who are elderly as well as who haven't had the second dose, they are among the highest. I don't have the actual percentage or numbers, but generally that's the pattern. So I mean, looking back, we can say it would have been better if there was a adherence and no deviation from the initial rollout plan.
So, if there needs to be a rationale behind the vaccination program, if the government is to arrest these deviations that you're talking about, what must the government do at least now?
Okay, it's very simple. I mean, getting back to the rollout plan, and getting back to the priorities. And so now probably the task should be easier because I mean, we have to give credit to also where it is due. For example, now the country has managed to get a lot of consignments of vaccines. And if you take the target population of over 30 years and above, then a very large percentage of that has got at least one dose, and about 44% or so has got both doses. In that way, I suppose now getting back to the priority list, that priority may be slightly different from the initial priority, because now there are a lot of people who have got infected and there are a lot of people who have got vaccinated. So I suppose it could be easier now. So the preference should be, at the moment, I suppose it should be getting into the priority and preventing of deaths. That's the most important thing.
Right. Thank you very much, Professor Indika Karunatilaka, former president of the Sri Lanka Medical Association. I now move my attention to Dr. Rajiv De Silva, immunologist, media spokesperson of the Association of Medical Specialists. Nice to have you back on the show, Dr. De Silva, after a lapse of a few months. Dr. Rajiv, interestingly, I want to drag your attention to a country that we've extensively spoken about as a country that has done well in terms of their vaccination drive. That is Israel. 78% of their population was vaccinated with the Pfizer vaccine. And now the country is discussing about the third dose, a booster shot. And we've seen how certain medical organizations, even in Sri Lanka, have said that a booster shot has to be given to the frontline workers in the country. Now, how rational is this, going ahead with a booster shot, because this is your forte? What are your thoughts?
Yeah. Now, when you look at Israel, they have given, as you said, maybe 70-odd% of their population the Pfizer vaccine. And what they have noticed is that with time, the effectiveness of the Pfizer vaccine against symptomatic disease has gone down from a high maybe 80s, 90s to something like 60%. So there are many more people now getting vaccinated people who are getting symptoms. And it is because of that the Israeli government has decided to give a booster dose. Now, when you look at the data, you will find that people are getting sick. Sick means they have flu, colds, coughs, fever. But if you look at the people who are vaccinated who end up in hospital or who need oxygen or who die, there is no reduction in the effectiveness. So basically they are trying to give this booster thinking that probably the level of symptoms or symptomatic infections would go down. I don't know whether it will go down. Now, in a situation where there is a scarcity of vaccines, we have to be scientific and we need to be rational. The most important thing that I feel, and I think a lot of others would feel, is that this vaccine should be there to prevent or reduce death or severe disease. Now, if you take the Pfizer vaccine, AstraZeneca and Moderna, up to 6 months, we have seen, now there is data coming from the US, there is data from the UK, where though there is infection and an increase of infection because of the Delta, there is no increase in people who are dying or people who are really sick. The severe COVID is the same. There is no reduction in effectiveness. So in such an instance, I don't think, this is my view, I don't think that you should give a booster just yet of these 3 vaccines. And now this is also echoed by none other than the man who is responsible, who is the lead of the Oxford AstraZeneca group, Sir Andrew Pollard. He says that he is totally against a booster dose with the AstraZeneca because it is effective. It is effective in reducing deaths and severe disease.
So you spoke about a 6-month window.
Yeah.
So let's take a look at individuals who have got these vaccines and they are going to lapse that 6-month window in Sri Lanka. Do you then recommend a boost shot to be given to these individuals in question?
Yeah, first of all, we are talking about 6 months after the second dose. Okay, we are not talking about 6 months after the first dose. That's number one. Secondly, what the data that we have shows that up to 6 months there is no reduction. That doesn't mean that there is going to be a reduction beyond 6 months, because two things. One is that it is not just the antibody, and for example with the AstraZeneca they have shown with one dose, just one dose, even up to 300 days you can see, you can identify neutralizing antibodies. It's about 1/3 of the peak, but you still have neutralizing antibodies, which is the most important antibody. But it is not just the antibodies. In the immune system, there are other mediators. For example, what are called T cells. Those are the cells, when you get infected, it clears the infection. So just by looking at the antibody doesn't mean, say, if the antibodies are low, does not mean that the person is not protected. There are other mediators. So at the moment, with these 3 vaccines, AstraZeneca, Pfizer, and Moderna, and we have information from about those 3 vaccines, up to 6 months, there is protection against severe disease.
What about Xenophon?
Yeah, now there is a problem with Xenophon and Sinovac. Fortunately, it is not there in Sri Lanka today. With Xenophon,
You are saying fortunately Sinovac is not there in Sri Lanka today?
yeah, well, I will not talk more about Sinovac.
Yeah.
Let's talk about Sinopharm.
Yeah.
Now, with Sinopharm in the Middle East, they have given Sinopharm and there has been infections, what are called breakthrough infections. Unfortunately, there is no data. There is anecdotal evidence. There is no data, published data on how bad the patients are and so on. And they have decided to give Pfizer vaccine for those people who have had 2 doses. So now,
that has a booster shot. Now,
As a
countries
booster
like
shot.
Dubai, they have rolled out that plan as well.
sorry?
In countries like Dubai, they have rolled out that
Yes.
plan as well.
So, but we don't have the data. We don't have the data on the Sinopharm. So with Sinopharm and with even Sinovac, now for example, with Sinovac, the manufacturer itself says that they might need a boost at 6 months, because these are inactivated vaccines, different from the other 3 vaccines. So it's possible that you might need a booster, but there is no data. So basically, if you take Pfizer and so on, we know that up to 6 months there is protection against severe disease. With Sinopharm, we do not know whether there is a reduction in immunity by 6 months.
Right. So if that is the case, Dr. Rajeva, is it prudent for Sri Lanka to vaccinate individuals in the island nation in Sri Lanka with the Sinopharm vaccine at present?
Yes, definitely.
Okay.
Sinopharm vaccine protects. There is no question about it. It protects. We don't know for how long.
Right. Dr. Rajeva, one question, and then I want to switch gears to Professor Atula Sumatipala. Dr. Rajeva, in your opinion, do you think that individuals who've got both the doses, also who are staying at home and who are watching this show tonight probably, must be very, very careful when going outside, when wearing a mask, when maintaining social distance? Does the vaccine itself give them immunity, or must they go through these protective mechanisms what has been reduced by the government?
Yeah. Now, initially, when we looked at AstraZeneca, we found that, or the researchers found that people who got the vaccine, they quite a good percentage didn't get infected. Maybe 50% didn't get infected. But now we know with the Delta variant, people who are vaccinated can also get infected. And if you look at the viral load in vaccinated versus the unvaccinated, it is the same. The only difference is the duration of excretion is less in the people who are vaccinated. So therefore, even though you're vaccinated, you personally are protected in the sense that you probably will not get severe disease, you will not die, but you are still a source of virus to other people. So
Right.
you have to wear masks and so on.
Right. So we are getting a lot of questions on our Facebook page as well as some private SMSs that have been directed to me. So I'll take up all these questions momentarily as the show goes on. Some important questions are coming through. But let's finish the first round. Moving on to Professor Atul Sumantipala, Chairman of the National Institute of Fundamental Studies. Professor, I understand that you are also involved in the National Operations Center for COVID Prevention. The number stands at 1904, if I'm not mistaken. Tell us a little bit about this number and how could people access this number and get some relief?
Yeah. Now, as Rajiv and Indika both mentioned, currently our task is to prevent the deaths. That's the priority. So as they explain, vaccine is one of the main strategies and not the only strategy. As he explained, even people who got the vaccine can be infected. Now, why we established this 1904 at the National Operations Center for Prevention of COVID is to try and capture the most needy people who should be evacuated to hospital as soon as possible. So let me first tell you how to contact and what to do. Then I will tell you how it came to being. It's not just an operation by the National Center for Prevention of COVID. It's a patient evacuation system through an integrated helpline information system. So what people have to do, it's not a telephone line. You can't phone, you have to send a SMS. What you need to do simply, this is currently confined to the Western province. Type your name, space, address, space, national identity card number, space, district you live, space, and symptoms categorized into 3 groups. Group A is actually people who are having breathing difficulties, because as we know, COVID affects the lungs. Category B is tested positive with symptoms. And the third group, C, is asymptomatic. So they have to simply put A, B, or C. Then that SMS comes to this operation center, and there is a group of volunteers, Indika, myself, Professor Manoj Veerasinghe, and there are other doctors, volunteers, medical students. Then we call the patient and assess them. In fact, we personally do it. Now the good news is, up to yesterday night, we have spoken to over 12,000 and we had to evacuate only 200.
So how many people are generally on a daily basis get infected with COVID based on the numbers that you receive?
No, it's very difficult to say because we are not monitoring that.
You said you got around 12,000 SMSs.
Yeah, 12,000
out of which
households.
200 were sent to emergency care at hospitals. Am I right?
No, let me finish, then come back to the statistics. Right. So then we phone and assess them. We generally give priority for above 60s, go through the symptoms, and then once we decide that they should be evacuated to the hospital, we phone 1990 ambulance service, Suwas area. And also this information is sent to Dr. Hamdani Anwar, who is in charge of the beds at the Ministry of Health. So then that process is facilitated and they are generally moved within about 30 minutes to 1 hour.
So, Professor, if I may interrupt you for a second. So, in your presence today at 8:50, we sent a message to this particular number in question, 1904, to see how effective this process is. So, the person who did that was Tarusha. Tarusha, if you can highlight as to what happened, the process, you sent the message to 1904, am I right?
Yes, so I listed my name, my address, and my identity card number, and the district that I live in, and I listed A there for having breathing difficulties. I sent the SMS at 8:50. Now it's been more than 1 hour, and I did not receive a reply as of yet.
Right. Now, why is that? Because now there were several numbers, Professor, that was introduced by the government. 1906, 1903, there were a lot of numbers. I can't even remember these numbers in question, but none of these numbers were effective. Now, this is a case in point.
Let me answer that. Let me answer that. Don't create any doubt now. Indica and I were there till evening. We were actually sitting and waiting for text. At the very first day, we had a lot of backlog. And today, until we left, we were seated expecting text. We need to find out about this.
Yeah.
Maybe the manpower is less today, but we generally attend because once the SMS
No, but the point is, Professor, if I may interrupt you, the point is now if there is someone who sends a message saying they have a breathing difficulty, expecting the SMS service to respond, you know that individuals can't wait for a prolonged time period with a breathing difficulty. What must they do? Because there seems to be no mechanism properly in place
to
look after individuals.
You are trying to get the negative side of it. I told you.
I'm not trying to get the. I'm trying to see how best can these mechanisms be implemented. Because there might be people at home who are watching this show today thinking 1904 works.
It works. Let me finish, please. Yeah. Let me finish because I don't want anybody to have any doubt about it. This system was established only 3 days ago. We have limited number of volunteers working there. What happens when the SMS comes, they get converted, transmission time, things like that. Then they are put in the computer system, which we pick up, right? So I'll find out about it before the show. We'll ring them and find out. But generally, this is not perfect, but it's much better because most of the people told us they can't contact the PHI, no blame to PHI because they are inundated with work, MOH. So access is very difficult. Now, although this is confined to Western province, we have had calls from Galle, Kandy, other places. We have generally cleared it. Before we came, there was nothing waiting, right? I'll find out about it. But once we get the SMS, I can guarantee, once we talk to them and assess, it's communicated to Mr. Sohan De Silva, who is the CEO, Suvasaria Foundation, and it's coordinated through Dr. Hamdani, and they are evacuated.
No, Professor, I don't think you're getting my point. What I'm trying to say is, now, having a system in place is good. When there is a pandemic of this sort, when there's a national crisis of this sort, when you have individuals manually doing something, how effective is that process going to be? Now, example, if you call the Suvasaria number, the ambulance service, they immediately answer. And relief is being provided immediately, almost immediately. But situations of this sort, why can't we get models that are workable, probably have a artificial intelligence system to ascertain as to how the process works?
I'll tell you, artificial intelligence can't assess patient management. So this can be improved. So let me finish. One of the good things with that, I actually spoke to Mr. Sohan De Silva before I came. Now, when people get panicky, they phone 1990. So when the ambulance service go there, sometimes people really they don't need immediate hospitalization, right? When we screen and decide, they get the appropriate treatment by transferring as soon as possible to the nearest hospital. That is being done right at the beginning. This can be improved. We need more volunteers. This is a voluntary thing. Let me explain to you how this came to being. It's not just somebody's fantasy idea. We last week, the lead of the center, General Shavendra Silva, then DG Dr. Asela Gunawardena, then Deputy Director General Lal Panapitiya, then Dr. Anwar Hamdan.
No, I'm not talking about these individuals
involved. This mechanism, let me finish.
Well and good. But
after that,
we have the process program right.
DG sent this circular on the 19th. So we have just taken off the ground. I'm sure Indika can vouch for it. We are improving.
Right. So we'll talk about all this and more as the show goes on. I'll come back to you, Professor, but I just want to quickly move to Dr. Meeru Chandradasa, consultant child and adolescent psychiatrist, Ragama Teaching Hospital. But just a very quick quick point to what you mentioned before, Professor. You are well aware that diagnosis is being done in countries like the UK through artificial intelligence.
That's US, UK.
Yeah,
We don't have
there is a process there. Okay, so just want to clarify because because moving forward we have to keep up viewers abreast as to there are global examples how things have worked out very well.
US and UK with Sri Lanka.
Yeah, well, that's fine.
We are even having difficulty in getting volunteers to do this.
Yeah, no, that's right. I understand. But anyway, we'll get back to that in a minute, Professor. I want to quickly move to Dr. Muru Chandradasa, consultant child and adolescent psychiatrist, Ragam Teaching Hospital. Dr. Muru, interestingly, how has the pandemic not only affected children, but also adults? Your time starts now.
Yes. Now, I just brought this picture to explain things. Now, if you see, if you are listening to news, like before the COVID pandemic, maybe you were focused on maybe sports, music, or any other thing you are interested about. But now, because of the attentional bias, we are always, when we are listening to news, we are focused on the number of deaths. So, one person in the family listens to the news, they will scream, okay, 194 have died today. So, this is the change in behavior in the population because of the social cognition and the stress created by this enormous challenge of the pandemic. So, the behavior changes first. So, we are attentive to negative news like just happened now, because this process 1904, emeritus professor in a reputed UK university and the professor of medical education, they are volunteers. This is a process that is just starting. But when we have stress, it's difficult to keep it in our conscious mind. So we need to displace it to somewhere. So this is not the time for a blame game. We need to find the correct process and the correct tunement to go forward. So the behavior changes. So we may blame others, we may found negatives, then the feelings change. We are always angry, frustrated, we are emotionally dysregulated, leave into negative
If you can
thoughts.
hold that picture, Dr. Chandradasa, I can ask my cameraman to zoom into that picture as well because we can see it now. Yes, you can continue.
Yes, so when the behavior changes, the feelings change, negative feelings creep up, then the thoughts change. The thoughts what are? Negativity, negative cognitions like feeling worthless, there's no value, we are all going to die, this is going to be a failure, these negative thoughts creep up. So this is a vicious cycle. Negative thoughts make the behavior negative, behavior make the feelings negative. So on Friday when the lockdown was noticed, the people panicked. Even maybe some people, actually daily wage earners, may didn't have any money to go to the shop beforehand to buy stuff. But some people, I'm sure, who had plenty of stuff at home, panicked, like in the fueling stations. They went and there was a queue for getting petrol and diesel. So this panic sets in because the lockdown was not maybe announced a little bit earlier, it would have been better. It would have been a more organized process. Because the people are in a negative mindset, everybody is panicking. Now what we need to do is, we have to understand that when the adults are in a negative mindset, there are kids watching this. The adults are the role models of kids, teenagers and the young people. So we need to keep calm and listen to the experts. So Dr. Rajiv clearly explained the scientific background of what we are going to do next, so we have to get together. So 1904 is a very good example of people who have contributed to the Sri Lanka health system in many valuable ways, coming together to help, because all the doctors working there are volunteers. I see a lot of positive aspects in this process.
Yeah, so getting back into the positive aspect in terms of 1904, the question mark is, I don't want an answer, Dr. Mehru, but the thing is, people are watching this show and they bank on the information that is being disseminated by individuals like you. And the last thing I want is individuals to say, this was telecast on Sirasa and this was telecast on TV1. As a result of that, we call this number and nothing constructive took place.
SMS.
Yeah.
Don't call that number.
Yeah. No, SMS this number in question, and nothing concrete took place. So that's the reason that we are bringing this issue up with regard to that number as well. However, if it's working, it's well and good. Again, getting back into the nuts and bolts of the topic that we're discussing about psychiatry, as well as how important it is to have a positive mental health in a time of difficulty. Now, take a look at India for an example. Our closest neighbor, Dr. Meru, they began schools today in the province of Karnataka. They've already began this process. When do you think the Sri Lankan government should open schools for the children to make it a time frame for them to have good mental health?
Yeah. So plan A would be to have the physical opening of schools to have the kids at school. But that is not possible because we know the experts already said that the Delta variant is highly contagious and the curve is just starting to rise. Plan B would be to have the online education going on at least for the essential grades. So all parties involved, education, government and other parties need to resolve this teachers union strike soon as possible, because I would like to plead to the teachers as well as the other educational authorities, this is the time to reconcile and come to a common ground, because children are suffering enormously. So when I was watching the sky today afternoon, there were so many kites in the sky because children are not supervised. They are outside the home flying kites because they don't have any structure to their day. They are just wandering around. So all these valuable years where they should be listening to a peer, listening to a teacher, learning things are wasted because of this trade union action. So then teachers would ask us, point fingers at doctors, aren't you the people who brought this culture at certain times? But what I have to say is this is not ordinary times. These are significant, extraordinary times that we need to come together. And I can clearly see in our clinics, the number of kids presenting with anxiety, depression, screen addiction, video games addiction have skyrocketed. It's enormous mental health burden, and it will not go away when the pandemic ends. It will be there for years to come. So we need to find a resolution for this conflict soon as possible.
Thank you very much, Dr. Minu Chandradasa. I open the floor for questions from our journalists. On to my immediate right is law student Sharon Benedict. On to my immediate left is Deshan Gonawala, and on to my far left is executive producer of the English News Desk, Tarusha Kumar Singha. So let's start off tonight's show with Tarusha.
I would like to pose my first question to Professor Indika. Professor, we talked about the three different mutations of this Delta variant that is currently prevalent in the country. Now, three different mutations of that particular variant have been found in the country. But have we identified what those mutations are, what their patterns are at the moment?
Yeah. So basically, I mean, I'll start with a very general statement. When we look at, say, when you think about RNA viruses, compared to DNA viruses, mutations are very common. That is due to the certain checks and balances within DNA virus are lacking in RNA virus. So, COVID or SARS-CoV-2 being RNA virus, mutations are common. And however, what has happened in the COVID-19 disease is the variations that are happening found to be more serious. Generally, it's the other way, but here the variants, what we call the variants of concern, are more than that is usual. Having said that, whatever the variant, the strategies that you need to take, the preventive strategies should remain the same. Similarly, how these variants appear? How these variants appear is simply, it is due to the human behavior, because virus can't exist outside the human cell. So, if the virus can't proliferate actually or increase in the number outside the cell. So here also outside human cells they cannot proliferate. So essentially the proliferation of viruses depend on human movement and human behavior. When there is more movement, more deviation from the public health measures, there will be more proliferation. When there are more proliferation, there will be more variants. And probably some of those variants should end up as, say, more virulent variants like what is at the moment, there's the Delta variant. And within that also there can be minor variations. I am not an expert to comment on that. When you do gene sequencing in a laboratory, sometimes you might be able to find those different variations even within one variant. That is possible because there can be certain changes in the gene sequence. Again, I am not an expert, so I am talking about based on my understanding. What I am trying to highlight is, yes, I think we have to give all the due credit to Professor Neelika Malaviki and her team for coming out with the, say, the sampling of Delta variants and then the gene sequence and find out. That's very important. But I think we have to focus on what we should be doing, because what is more important, regardless of the different what happens within a variant, what is more important is prevention, the focus on the public health measures, and then adherence to that so that the variations will not be proliferating more. So I think that should be the area that is coming. I mean, I'm not at all undermining the hard work by the scientists, which is very important. I mean, they are doing their work. They provide valuable information, but that valuable information should be adjunct to the basic public health approach. So it is scientifically important, I agree. Having said that, it will never change what should be the priority public health focus at this moment. If you think about the current situation and the spread, the disease is spreading, the rate the spread is spreading, and the number of deaths, the current priority remains to be controlling this epidemic, and more than that, reduction of deaths. That should be the priority. I think nothing should be allowed to deviate us from that priority of reducing the deaths.
Dr. Ajiva, just on that, since Professor Indika also brought this up, I want to quickly quote a tweet by Dr. Chandima Jivandara. He said, on average, people began having symptoms 5.8 days after infection with Delta, 1.8 days after they first tested positive for viral RNA. That left almost 2 days for individuals to shed viral RNA before they showed any symptoms. Before Delta emerged, individuals infected with COVID took an average of 6.3 days to develop symptoms and 5.5 days to test positive for viral RNA, leaving a narrow window of 0.8 days for oblivious viral shedding. What does this mean, and what is the implication to the public?
Well, I thought that even before the symptoms appear, even with the earlier variants, they were infectious for about 2 days. Mm-hmm. So I don't actually understand what he says. So basically, with the Delta variant and with the other variants, with the Alpha variant there is more virus. I mean, that is what we have to understand. Before you are before you show symptoms, maybe 2 days before, you are infectious. And unlike the other variants, you have more virus. So there is a greater chance of you spreading this if you are infected. So that is the thing. So you have to be even more careful with this variant compared to the other variants.
Dr. Ajiva, just a very quick question. One of our viewers have posed this question. If a senior who received the first vaccine in February 2021 and was not able to get the second shot when it became available end of June, however, contracted COVID subsequently, when must he take the second shot? So basically what the question is, in the event someone was eligible to take the second shot, however, during that time frame, if he or she contracted COVID, when is the next time in which he or she should take the second shot?
Yeah. Now, it's like this. If you get one dose and then you are infected, it's like getting a second shot. In fact,
it's like getting a second shot.
It's like getting a second shot.
Okay.
Because your immune system that has been primed with the first vaccine is now primed with the natural infection, and you get a very good immune response. So WHO sometimes some time ago said, you don't need another shot even, or you can wait for some time. But generally what we'd say is wait for about a month after the initial positive PCR before getting the second dose or before giving the vaccine. Now, basically, I mean, I don't know whether it may be certain people might not agree, but I think there are some immunologists who agree. If you're vaccinated and instead of a booster, if you get a mild viral infection, COVID, it's much better than getting a booster because you get a very good immune response to the entire virus.
But Dr. Rajiv, that doesn't mean that people who got both shots should try and contract the virus.
No.
Right. Dr. Rajiva also, Professor Indika highlighted this point. He spoke about the vaccination policy in Sri Lanka. Since we have limited resources, how do we roll out these vaccines? And he said that the vaccination policy that we had a very good vaccination policy, but that was completely disregarded. And now it has come to a point where it's out of control. But judging by the policy that we're at least following or should follow right now, to the eyes of a person in the general public, there is no clear vaccination policy because the Xenophon vaccine is being rolled out a lot. But there is an issue there when it comes to people who want to travel overseas, people who want to go for their studies. Now, I do know that medical specialists say the first vaccine is the best vaccine that you can get. However, there are issues like that coming into play as well. Then we have other issues like the Moderna vaccine only being given in Kandy, only in certain places. And I personally know people who have traveled from across the island, various other districts in the island, and traveled to Kandy, get the vaccine, and now even some of them are suffering without being able to get the second dose of the vaccine because there are lockdown measures. And in reality, they don't live in Kandy, so they can't just walk to the vaccination center. So on this matter, is there any possibility of rectifying how this is done? Are there any efforts being made to rectify this vaccine policy or the lack of one in Sri Lanka?
Yeah, I think they are now trying to vaccinate the vulnerable, the remaining vulnerable people over 60s who have not got any vaccine. So I think that is a step in the right direction. As to what happened in the past, well, there were mistakes. Now I suppose you can't sort of talk about those mistakes. I mean, those were in the past. Now what is important is that we don't repeat the mistakes. So I think it's going in a slightly better direction now. It's being more targeted, and hopefully in the next, say, 1 or 2 months, we might have all the vulnerables immunized.
Professor Indika, you said that this vaccine policy has gone out of control, and now at the end of the day, there's no one to take responsibility for it. Not to start pointing fingers or anything, but the people who decide on this vaccine policy, is it the same people who deviated from the initial vaccine policy that are still making the decisions on said policies? Because it's highly unlikely that they will move forward and rectify themselves given what has happened in the past, of course.
Okay, so when it comes to taking decisions, there are expert committees, there are expert bodies. When it comes to vaccination also, there have been expert bodies that has been existence for so many decades and years, because Sri Lanka is one country that has been leading in vaccination. It's the same here also. The vaccine policies were developed by the vaccine committee. I think Dr. Rajiv is also one of the members in that. So the expert bodies are there. They provide the clear advice and then give the guidance. But they remain guidance, because ultimately when it comes to ground level and the operationalization, then it depends on so many other factors.
Yeah, but Professor Indika, if you look at the past, the way in which NMRA officials have been resigning from their positions, that also raises an eyebrow. Because people start wondering now, as I think Dr. Rajiv didn't want to speak too much about it, saying that it's quite Sinovac, that it's quite fortunate that we did not get the vaccine yet, but we have given the clearance to even manufacture the vaccine, because we saw how the Chinese ambassador made a remark on Twitter saying that the vaccine will be manufactured in the country. So these raise eyebrows. Now that's what Sharon is also trying to say. There are issues. We are not trying to point the fingers at anyone, but these issues need to be rectified, isn't it?
Of course, there could be issues. I mean, there are issues. There's no doubt about it. One thing again we need to realize is this is not a normal time. I mean, this is a pandemic and probably a crisis situation. I mean, if you again think back about the in the past, Sri Lanka being one of the leading countries related to vaccination, with the vaccination policy and immunization well established. So how could this happen? So that is where the concerns that you have raised coming into.
Professor, if you don't mind, please, I can give you a classic example about the rapid antigen test kit being sold at private hospitals now for a fee of 2,000 rupees. This doesn't cost that much. And certain countries in the world are giving these kits free of charge. So there should be a proper mechanism, right?
And Professor Indika, if I'm to just add to that, the government has imposed a maximum price on 2,500 rupees on rapid antigen tests.
2,000 rupees.
2,000 rupees, right? And that is the price that only a few companies, or if maybe I stand to be corrected, maybe even one company or two companies, it's been monopolized, and therein lies the issue. Because if this test really costs that low, maybe other companies should be allowed to bring it down to Sri Lanka and sell it at a lesser price if they do have the capacity to do so.
Yeah. Again, I think rather than looking at the pricing or the distribution of who should be selling, we should be starting from the point, what is the strategy for testing? That should be the strategy. Actually, when this the initial decision was to use PCR as a testing, it was only later that the rapid antigen came in. When the rapid antigen came in also, there were very specific indicators. And they were to be used only for that indicators only. Later also that has changed, and it has become little widespread and maybe has gone little out of control. So all these things, it is you can't take only one thing in isolation, like the price of the thing, antigen or whatever. What we need to look at is actually the testing strategy, and what is PCR is meant to be and what is antigen is meant to be, and that also change.
Yeah, but Professor Indika, I stand corrected, but you are very well aware these rapid antigen tests could be even carried out by an individual when he or she is at home. They don't have to necessarily go to a private hospital to get a rapid antigen test. They could do so at home and then realize whether they're positive or negative.
Yeah.
Right?
Correct. Yeah.
So, getting back to Dr. Professor Atula Sumadipala, with regard to the mechanism that is in place, I interrupted you before when in your opening remarks. You can continue.
Thank you very much. I actually came for this program to talk about this because, as Mur very correctly said, at a time like this, now this particular text we are talking about is 1 versus 12,000. So we, both of us represent here, we can give you a guarantee. But what Muru said was absolutely right. There are things called thinking errors. As psychiatrists we know, we maximize the faults, weaknesses, we minimize the benefit. That's happening with the vaccination thing. Now there are certain flaws, issues with vaccination, but having some form of a vaccination was better than nothing. So similarly, this system we established to address the thing. So I don't want anybody to have any doubt. That's why I was going to describe the process of establishing this.
Professor, I'm getting back into this again. Why? I'm saying this because of a reason. Because as an individual, I tried my level best to connect to the number that was given by the government in terms of the vaccination drive. I tried for hours, didn't work, and then I had to speak to a colleague at Newsfirst to get the necessary information to make sure that one of my friends got the vaccination at the end of the day. Now, if there is a time specification saying you can contact this number from 8:30 up until 5 p.m. in the evening, if it works during this period, if it works effectively, it makes sense. But if you open it out on a 24/7 basis, and if someone is really finding it difficult to breathe, and they send a message to this number, and if they don't get a response, and if a fatality happens as a result of that, who is going to be held responsible?
Will you give me time to answer your question?
Of course, yes.
Right? So you are talking about a telephone line.
No, these are SMS that is being sent to this number. Now, Shalan sent a message to this number as well.
Let me explain, please.
Yeah.
I believe Professor Indika also would like to share some views on this matter.
Yeah, because I think we should not go into conclusions, because regarding this SMS process, actually, when you SMS 1904, there is a particular way that there's a particular format, because this is like what you have previously mentioned, Shamir has mentioned, that is a semi-automated process. What happens is, if you take the 1904, the idea is to identify who need to be evacuated and who need home treatment or who may need intermediate treatment. That is very important at the moment. Actually, if you take the current situation, the priority is immediate identification of those who need treatment and evacuation. That is the priority or the need of the nation at this moment. And Shamir very correctly mentioned that there were so many lines, and some lines you can't even get connected into. So that problem was there. And there were so many different lines working in isolation. So there was a real need. There was a real need to integrate all these systems together. Now, previously last year, actually, when I was the president of Sri Lanka Medical Association, in collaboration with Mobitel, we started the 247 call system where anyone can call from anywhere and get an advice from a medical doctor. So that system too was there. And this time, we thought it was prudent to activate that system, but related to the COVID situation, so that when you call, you can get connected with a doctor and you can give advice. So that is one way. And getting back to this 1904, so that was also being developed by the National Operations Center. So what many of us felt is that, yes, 190 is there, 247 is there, then there could be other systems, then there's sewers area, and there's hospital system. But if we work in isolation, then what you are telling would happen. There need to be a proper coordinated mechanism that integrate everything together. So the idea of bringing this together, actually this has happened in very short time. I suppose Professor Somthal within maybe 1 week.
There is no question, Professor.
So,
there is no question about the integrity.
Shamir, let me explain.
Integrity of the system.
True.
There is no question about that.
Sure.
And I'm very glad that individuals like Professor Atul Sumadipala and Professor Indika have joined a common cause on a voluntary basis to make sure that the people are aware. But the question is, if there is such a mechanism in play, and if the people are relying on that particular system in question, it has to effectively function.
Can I add to that? Now, so this will be improved. We'll look into that. So people have choices. Say, for example, if there is an emergency, they can still call 1990. It's not prohibited, right? So if there is any delay due to some reason, they can still contact 1990 and get to hospital. But we will improve this and facilitate. I can guarantee you that we will improve the mechanism. The reason is, that's why I wanted to tell you how it came to being. It's not just the National Center for Operations, the Director General, Deputy Director General, then the people who are in charge of beds and sewers area all got together and put this. It's only effective for the last 3-4 days. So we will face challenges, issues, we will rectify. So this, in my opinion, is better than absolutely nothing, because we attend to it.
Actually, let me again continue from there onwards. Now, getting back to this 1904 system, it is essentially an SMS system. I think it's very important to explain this to all the viewers so that they'll get a clear idea, because at the moment people are very confused about what to do. One clear advice, if I have to give one very clear advice, the clear advice that I can give is, if you want to get advice for your illness, you can call 247 from any of the major mobile lines. That's one simple advice, because we have to make advice as simple as that. Second simple advice I can give you is, if you are positive, or if you think that you are positive, and at the moment, if you are in the Western Province, send an SMS to 1904. Again, I will explain how this happened. This is a SMS system which is semi-automated. And this semi-automated system, when you SMS, there's a particular format. Now, Tarush, you have to start in the category. There are 3 categories, A, B, C. A is the severe category, then B is the mild illness, C is basically asymptomatic.
In the SMS, I listed A.
So when you are putting the SMS, you have to start with A, then put a space, then age in numbers, then space, then the NIC number, then the address. The mobile number would be basically automatically identified from your mobile transmission tower. That is semi-automated, and everything is automated. Once you send the SMS in that exact format, that is categorized into 3 areas.
Professor Indika, just one more time, if you could explain the format.
I will, yeah. So, it is when you basically go to 1904, and if you type help, HELP, you can try it now also. You go to 1904 and type HELP. That gives very clear instruction in all 3 languages, and it gives a format. Because if there's an error in format, the semi-automated process will send that SMS into a different category. So the correct format is put the category first, capital A, and space, age, space, NIC, space, address. If you send it in that format, actually we have received about 11,000, they have been clearly categorized. What
Doctor, let me just interrupt you for a second. Now, you said this is a semi-automated system. So, if in case the format is false, would you get a message saying that your registration is successful?
Okay. When the SMS is sent, you receive a message that you have you have sent your SMS has been received. I suppose you got that message.
I have.
You have, yeah. Okay. So,
which means the format is correct.
Yeah. Regardless of the format, when you send an SMS, whatever, because you can make mistakes, no? Whatever SMS you send, as soon as it is received.
Right. So let's get this clarified properly for the benefit of our viewers.
Very important.
So let's go step by step. Okay. If you don't mind, Professor, I want Charlan to do exactly with the process, and we'll see how best this system works.
Please,
right?
Yeah.
Okay. First of all, what must you do?
Yeah. First,
you open the SMS portal, right? And then
1904.
Now, if you are not very clear about what to do, what you have to do is type HELP. Help. Help.
HEALTH.
Should it be in all capitals or anyway?
Anyway, but just put in all capital.
Okay.
Then you will receive very clear instructions.
Help. HELP.
Help. Yeah.
Help. Right.
Then within second you will receive very clear instructions on how to proceed. Shalan, have you got?
Right. So we'll go step by step to make sure that the process is.
Yes. I did receive.
Yeah.
I did receive.
Shalan, can you tell what is the?
පහත ආකෘතියට SMS පණිවිඩ එවන්න.
The third message is in English, Shalan.
Yeah, and it's in English as well, yes. Please send an SMS message in the following format. Symptom code, space, age, space, NIC, space, address.
So,
symptom
code, and then
age.
Name, age.
Symptom code, space actually.
Symptom code, space, age, space, national identity card number, space, address.
Yeah. So actually,
send a message.
Yes.
Yeah.
Right. So you can confirm.
Yeah. So you have to put it in that format.
No, because the format that Professor initially told us before was name, address, national identity card number, address.
The district.
The
district, and then the symptoms.
Okay. Yeah.
So we'll try this format as well.
Because I mean, this is the exact format.
So symptom code, age.
First you start with the symptom code. So if you are having severe illness and if you want immediate response, you have to type A.
So
type A and put space, and then type A, put space, and then put the age, the 2-digit.
So just for the benefit of our viewers so far, until Shalan gets his messaging quite fast and aggressive at the moment, the process is very simple. 1904 is a number that you should send your messages to. The message should be help, H-E-L-P, help, and then you will get a list of instructions. Based on the instructions given, there are 3 variants that you can report to this particular number in question. That is when you have breathing difficulties, when you have tested positive, and when you are asymptomatic. Correct me if I'm wrong, gentlemen, as we go along.
Yeah.
and then you have to send a message to the symptom code first,
Yeah.
whether it's A, B, or C.
Yeah.
Then leave a space, and then age, space, your age, the national identity card number, space, national identity card number, address, space, and the number in question. And then we will. And
Perfect.
did you?
Can I
I
also
sent
make a
message.
request? Now,
Yeah.
not for people to send test messages.
No.
No. We are testing
We were-
this
Yeah.
process
In fact,
to
we-
make
we-
sure it's effective.
We got something like that. Actually, I spoke to somebody from KGOL. He vehemently apologized and said, actually, I wanted to check this number. That's why I sent it. So I would request the viewers not to try, because everybody will start typing to check it. It will be unnecessary load of work for us.
Yeah. So, I think Shalan, you will get your.
Yes.
You have got it, no?
Yes.
Yeah. So what will happen is, now when these SMS are sent, they'll be automatically categorized into A, B, C based on, because now you can see there are spaces, no? Those spaces are programmed deliberately. When you send in, they will be put into an Excel sheet, and that Excel sheet will automatically populate, and that will automatically identify your mobile number also. So you don't need to type in your mobile number. That will be identified based on your tower.
Right.
And other details also. So this will go into operation center in the National Operations Center, and there are officials who are working there 24 hours actually. They will basically, the system immediately gets populated into 3 categories.
So
A
this
category,
is only for patients who are either tested through an antigen test or
both.
PCR or
All. Basically, if you are PCR
right.
positive, antigen positive, or even if you suspect, basically like if you are, because at the moment we know there are many who can't get themselves tested. So even if you suspect, still, because we don't want to miss anyone. So what happens is this goes into the system, immediately categorized. And sometimes, I think this is what has happened, sometimes they might not go into any of those categories.
Right. So we'll park that thought for the moment, Professor, and then move on to Dr. Rajeva. I want to speak a lot, Dr. Rajeva, with regard to this immunity systems that people have. Can an individual go and check his immunity, go to a doctor and check his immunity, whether he or she is going to be infected with COVID, or how does this process work? Is there a system in play, or can they do a test?
Basically, what you're saying is to see whether a person's immune system is
Immune
working.
system works.
No. If someone has recurrent infections, for example, there are people who have immune deficiency, recurrent infections, and so on. Those people have to be tested, but normal people don't need to be tested.
Dr. Rajiva, when we speak about these 3 variants that are already present in Sri Lanka, it was a big ha-ho. Many news networks picked up this, saying Sri Lanka is the only country in the world to have these 3 variants present in the island nation. Now, this was a big issue for most of us, thinking Sri Lanka is now in the red line. Are we in a dangerous or precarious situation at the moment?
No. I mean, I was speaking to Professor Malaviki about these 3 variants, and what she said is they don't have any data to see whether, I mean, she thinks that there is no problem with the vaccine. Whether there is an increase in transmissibility, we do not know. So I think too much is put on these 3 variants at the moment. Let the scientists and the others decide whether it's of consequence. So at the moment, there is no data.
One small request from our panelists, of course, with the COVID-19 pandemic and the fact that we have to wear masks and face shields, there is a little bit of an issue in hearing you. We've been notified by some of our viewers that what you're saying isn't clear at times. So if you could speak just a little bit louder, that will be much appreciated. I'd like to direct a question to Dr. Muru. Now, we've been speaking about the most vulnerable people in the society who are passing away, which are our elderly community, but also not as much as the death rate isn't the same, but of course the effect that it has on children, the situation that this has created in the entire country, and the effect that it has on children is of course extremely concerning. Now, initially when the pandemic began, we thought maybe it'll be, I mean, we as in laymen, people who are not medical experts, thought maybe 1 year, 2 years, but this seems as if it will continue in the foreseeable future. And every time we get close to opening schools, there is a rise in the pandemic. There is another wave beginning. Something went wrong somewhere, and we don't get to open schools. How long can we continue like this?
Yeah. We also have to consider that when we lose someone above 60 years or when we lose someone above 70 years, we are losing a grandfather, grandmother. As we all know, grandfathers, grandmothers are integral part of our social community because children depend on them, working parents depend on grandfathers and grandmothers. Even though maybe the majority may be more than 70 years who have passed away, the negative emotions and the grief and the unprocessed grief, because you can't even grieve in this pandemic because there's a limited number that can attend a funeral. Sometimes the children may not be able to even see the face of the grandmother or the grandfather in these circumstances. So there's unprocessed grief. So as we know from the tsunami, and Professor Sumatipala has conducted so many research about that. So when the grief is unprocessed, the impact lasts longer and it's more significant. So when the schools are not open, there's no way for the children to ventilate these emotions as well. So they are confined to home. They see their loved ones may be ill or passing away. They are confined to home and there's no opportunity for ventilation. At least if there were online classes, at least they can pass a text message to their friends, maybe make a slight joke, or talk with their teachers, and there is some compensation, there is some ventilation and catharsis, so they feel better. So we need to find ways. So plan A is to have a physical opening, plan B is to have the online education. If that is also not possible, plan C is the parents need to take charge and start educating. Like for example, if you have a class, there may be some parents who can at least contribute it in some academically significant way to the other kids as well. So we need to get together as parents, as responsible citizens, and start some form of education for our kids. So many people are already doing that.
Doctor, just a passing thought, of course. Since you propose that parents should take charge now and educate their children in whichever way they can, would it be advisable that the Ministry of Education looks into this matter, prepare a certain short curriculum, a short series of maybe something sort of a textbook that parents, that can be shared among parents, because of course we're living in the digital age. It's as simple as sending a WhatsApp message. So that can be shared around so that parents who are maybe not well versed in certain subjects that should be taught to children, not only in grade 1, 2, 3, 4, 5, but maybe even higher grades, to be circulated among the population. Because at the end of the day, like Professor Indikata said, like Professor Atula also said, we tend to look at the negatives and not focus on the solutions. So is this a possible solution? Can this be done?
Very good suggestion. Now in the short term, what is important is the educational experts say when a child is learning through an online method, the important thing is for the adult is to make the connection between the real world and the virtual world. So they are studying in front of a screen. The essential thing is to make a connection what they learn through the screen to the real world. So there are already, we have to appreciate what has been done by the Ministry of Education. There are already very good learning material online available. But some students may not be able to access it due to the economic difficulties and internet access, but some kids may be able to access them. So what the parents can do, after they come home from work, they have to sit with their kid while the kid is listening to what is the online material available from the Ministry of Education. They need to guide them. So even though the actual teacher is not there, the adult can guide the child while they are learning through this video.
So, Dr. Rajiva, today there was a breakthrough as far as IDH hospital was concerned. They said that they found out new evidence to treat COVID patients, and they were the first to do so. Are you aware of it, Dr.
No, you're talking about ivermectin?
IDH hospital, a group of doctors were able to find a way to treat COVID patients in a streamlined method. Professor Indika, are you aware of it as well, or?
Yeah, I'm not sure about the IDH hospital. I mean, there are talks about some new drugs that are being used, but that's very selected. Not ivermectin, obviously, because that is not approved in Sri Lanka. But there are other new drugs that have been in operation. But generally, the management strategy hasn't changed. The management strategy for the COVID-19, the general strategy hasn't been changed. Basically, it's the early detection and then looking for complications, basically looking for hypoxia, and if there is detection in the oxygen levels, then basically again there is a treatment strategy that you would go like the oxygen supply, and as well as then sometimes there may be need for steroids at the hospital level, definitely not at the other levels but at the hospital level, and sometimes if there is a risk of moving into bacterial pneumonia, antibiotics may be needed, and if there is the blood disorders and thrombosis, so on and so forth, then anti-clotting drugs that are required. So there is
do we have the necessary medication to treat acute COVID pneumonia patients right now in Sri Lanka, Professor?
Sorry, I couldn't get it.
Do we have ample medicine to treat acute COVID pneumonia patients?
Okay, I think that question should better go to someone who is basically actively managing the disease at the IDH level. Yeah. But one thing I could say is, at the moment, the basic management they have, the basic management that is required to treat at the ICU level as well as the high dependency level, that is there, because what is most important is to detect the complication early and then attend to that. The basic hypoxia level, that's the most important that is going in, that level it is there. However, having said that, if the patient goes into hypoxia, one of the most challenging thing would be the oxygen supply. The oxygen demand in the hospitals, now it is on the increase, and if it goes on, as time goes on, it might not be possible.
Because we got 100 metric tons of oxygen yesterday.
Yeah.
Today we got 40 metric tons of oxygen again through sending a vessel to India. So we are right now fully geared to meet the demand, right?
At the moment, yes. Yes. But when it comes to oxygen therapy, it is not only the gas oxygen that matters. There's a delivery devices, so on and so forth. So they are also required.
Right. So I'm going to ask you a very technical question. I don't know whether I should ask this from Dr. Rajiva or Professor Indika. Either one of you can speak on this. What is providing oxygen and nebulizing means? What's the difference between these two, if I may ask? Is it the same process or is it two different processes?
It's different.
It's different, yeah. Oxygen, I mean, nebulization is where you use some apparatus to basically, for example, in asthma, you basically get certain drugs like, say for example, salbutamol. You make it into an aerosol and sort of get the person to breathe. You make it into an sort of a airborne kind of thing for a person to breathe. That's what nebulization is. So oxygen is a different thing. You just give oxygen either through...
So because I just want to distinguish these two differences. Why, Dr. Rajiva? Because in the event someone is finding difficulty to breathe, if it's because of COVID, they should immediately seek medical attention to make sure whether it's a process of needing oxygen or nebulization. That decision has to be made by a consultant doctor, right, Dr. Rajiva?
I mean, yes, if someone is finding it difficult to breathe, definitely you have to go to hospital and you have to, I mean...
There is no home care?
No.
Right.
Dr. Rajiva, I've also received another question. How do people check their antibodies count? Hospitals refuse to do this, according to the viewer.
The WHO basically says that you should not check your antibodies following immunization. If you're talking about immunization, you should not check your antibodies.
Yes, please.
There are antibodies and antibodies. So basically, the antibody that is important is what is called neutralizing antibodies. And that antibody test, or there is a surrogate neutralizing antibody test, that is the most important one. there are other antibody tests which are, it will show that you have been infected or that you have been vaccinated, but whether it is protective or not, you don't know. So there are different kits.
Right. So, Professor Atula Sumitiwala, I'll pose a question to you, and then you can, or you want to.
Can I add?
Yes,
something?
please.
I just received a text from the center, from Dr. Atapattu, because I want to establish the credibility. Sir, we have responded up to 200 messages so far. If you can kindly send me the sender's number, we will check so far. Then once again, he just now sent me saying, sir, we have responded to all SMS so far. I will be here personally till midnight.
And Professor Atula, the initial message that we sent at 8:50, I believe the format was wrong.
No, Shaun, you're wrong, because that was shown to Dr. Atula Sumitiwala. Correct me if I'm wrong, Tarusha. It was shown to Dr. Atula Sumitiwala and then sent out.
The system was
but that was corrected by Professor Indika. But we have still not received a message.
So let's check what.
Let's wait. No, we will wait. There's no problem. See, Professor, it's not about locking horns or trying to figure out whether the system works or not. We have to advise the public when we are on national television on a system that works. That's what we are trying to envisage and try to achieve in shows like this, because there are many people watching us and they should place confidence in individuals like the four of us to pose the right questions to you and get the right answers from you as well. So it's not about finding deficiency in the process, but to make sure we provide the right information to the public. Professor Atula Sumitiwala, I want to talk about ethics surrounding the vaccination drive. Now, there are many individuals in Sri Lanka who believe that they don't want to get vaccinated because they don't go out. Henceforth, there is no necessity for them to go out, hence they won't get vaccinated. So the ethics surrounding the vaccination drive is very important at the moment to discuss. What are your thoughts on this?
Yeah, ethics, when it comes to ethics, it's about moral rights and wrongs, which is not absolute. Ethical issues can be applied at different ways. Now, when it comes to a vaccination, yes, the individual right to refuse a vaccine is there. However, if that affects, by refusing the vaccine, if the person gets infected and he is spread to the community, because public health is about greater good. So there is an issue. So individual has a right to refuse, but by doing that, if he put somebody else at a risk, there is a serious ethical issue. The way I think, when I think about ethics, that's the issue. So therefore, in a pandemic like this, it's absolutely must. Everybody should get the vaccine. Let me finish. But that doesn't necessarily mean you can give the vaccination at gunpoint. We need to persuade them to give.
Educate the public.
Educate and information, persuade, get their loved ones to explain and do. Why I say this, there is a considerable amount of people above the age of 60 who has not got the vaccine. So we need to try and find out why they are worried, why they are refusing. And we also have to, you will say, there is an anti-vaccine lobby all over. People talk about right for human life and right for animal life, but some of those groups, not in our country, other countries, kill human beings for the animal rights. So this type of things happen. So my point here is, from a public health point of view, it's unethical not to get the vaccine. It's unethical to persuade people to not to accept the vaccine. The most ethical behavior is try and educate, try and persuade, and get the maximum.
Professor Atula, we are now speaking of a possible mechanism coming in the future, vaccine mandates, as in you cannot visit public places, you cannot move about the community if you have not been vaccinated, and this is to be mandated as law. So technically, if you are not vaccinated, you can't leave your home or you can't visit public spaces. In your view, how ethical, how practical can this be done? Because this has already been challenged in the Supreme Court.
As always, when you want to lock down the country, and in fact we did a survey, 75% say lockdown, 25% say don't lock down. So similarly, I'm pretty sure there will be a group of people who say no, that's wrong. The other group say yes. That depends on how you interpret this. In my opinion, it should be mandatory, but getting the maximum amount of vaccination, we should try and educate people and try and persuade them to get it, and if they don't get it, and they are held responsible for not only for their own health, spreading to the others, which is, in my opinion, unethical.
Professor Atula, so
is there any plans in place to educate people as to why they should be vaccinated at present?
It has been done at various levels. When it comes to vaccination, yes, there had been a lot of, everybody talks about vaccine. But still, I think there is a gap. Number one, vaccine is not the only solution for this. It's one of the most important things, as Rajiv and everybody said. That's a must. Even if you are vaccinated, because some people believe by standing in a queue is sufficient. No, you have to have the 2 doses. But still people can get. The argument is, counter argument against vaccination is, some people say, people have asked me, what's the point of getting the vaccine if vaccinated, fully vaccinated people get the illness? If you take 100 people who have not vaccinated, 100 people who are vaccinated, obviously the number of people who get the disease is less in vaccinated, complications are less, so therefore you should vaccinate.
And deaths are significantly less.
Of course, of course. And he said, 75% of the deaths are
No,
more than that.
94%.
94% are people who are not vaccinated.
Unvaccinated.
So
1% are vaccinated.
Yeah,
fully
so
vaccinated.
what we need to keep on telling, because health messages doesn't get registered as, and when we want, Muru will say there's a lot of things in health education. Sometimes we have to pitch it in a way that people understand. When we teach children, the way we teach for grade 2 and grade 6 and O-level, A-level is different. So therefore, pitching this has to be at different levels, so that has to be a unified message. So that unified message, the correct message is, vaccine is extremely important, but that is not the only thing to protect. While we vaccine the maximum, we should also follow other public health protective mechanisms, still knowing even fully vaccinated people can get, as Ajib correctly said, they may spread, so therefore it's very important their behavior.
I think it's very important, Professor Atula. Why? Because we saw the recent Minister of Mass Media who was appointed, Dallas Alhapirima, at a public rally said very articulately, it's not about sticking to superstitious beliefs like putting pots into the river or having have toxins, tonics. That's not the way to move forward. However, my question to you now is about the Ayurvedic doctors who believe otherwise. We see a lot of Ayurvedic doctors who are coming on media channels and saying about immunity, that there are ways in which immunity can be built. I saw recently on social media, there was a doctor who said, I am not taking the vaccine and I'm not allowing my patients to take the vaccine as well. So this sends out the wrong signal, isn't it?
Absolutely. So let me be very clear about that. My position, we have a traditional knowledge not only in medicine, even ancient technology, we have a huge history. So Ayurvedic treatment has a place, definitely for certain things. However, I am against if somebody says don't vaccinate, believe only in this. It's no harm if people take home remedies, other things as secondary things, and even sometimes you will agree with me, the way people try to cope is very different depending on the culture. Some people will make a vow to the temple. Doing all that is fine as long as you take your vaccines, you follow all the public health measures, and then if you want to take anything in addition which is not counterproductive is fine. But when people give wrong messages saying don't do that, it's again a thinking error, black and white, it's white or black, it's wrong, whoever does it. Lets the people cope the way they want, but if somebody prevents, because there is no alternative for oxygen. If somebody is ill, having COVID pneumonia, he has to be in a hospital giving oxygen, isn't it?
Yeah, that's why I spoke to Dr. Rajiv also about this nebulizing, taking inhalers, all that.
That's a must. If somebody has to be in ICU, they have to be in ICU. Yeah. I heard somebody telling today, once you get the illness, Whether we like it or not, it's not just Western medicine, it's the modern medicine which has evolved through the history. So currently, even the Western modern medicine lack the full knowledge to tackle this.
So I want to quickly switch to Professor Indika Karunathilake, former president of the Sri Lanka Medical Association. Professor Indika, with regard to how things are moving out, now we are on a lockdown period, but we have not got clear-cut commitment yet from anyone in terms of the airport. Why is that?
Okay. Yeah.
Because we still see individuals coming to Sri Lanka.
True. Correct. Yeah. I think again, the priority at this moment should be to stop the wave of deaths. So that's the immediate priority. The question that you have asked regarding airport, yes, it is important. Why it is important? Because that would also prevent the new variants coming in and the spread of the epidemic. So that's very important. So I mean, we have two priorities at this moment because there are so many patients coming in and the deaths. And what happens is, generally what happens is, now we are seeing a wave of patients coming in, but the wave of deaths will be coming several weeks later because the deaths that we are seeing are actually the deaths that were due to the disease that were contracted several weeks earlier because of the pathological process that is taking place. So the deaths due to the current numbers or the current surge will be coming in another few weeks' time. So I strongly believe the ultimate objective at this moment is to prevent the deaths. That is where the immediate identification and early management of patients comes into play. To what you have mentioned about the airport and the preventive measures, all these things matter, but at the moment the most important priority is this. Now previously we had another question about the sophisticated mechanisms and the treatment also. No, that's very important. I mean, there are new drugs, like say one example, tocilizumab, which is a very expensive drug and which needs very sophisticated investigation method. But once a patient gets into a stage where they need ICU treatment and that kind of sophisticated drug, is too late actually. That's the experience of the clinician. What is very important, if you want to save people, if you want to prevent the wave of deaths that are coming, what is very important is the early detection of patients and immediate intervention. That is where the treatment methods that you are asking comes into play. Rather than really thinking about very sophisticated methods, the most important thing is detect them as early as possible. Because if you think about the pathology of this disease, what happens is it starts the effect in the lung to the pathological process. And once this pneumonitis and pneumonia process starts, it becomes a catastrophic process. And there are several complex mechanisms that are proposed, which I am not going to go into detail. But when this process starts, it's too late. So what is very important is to detect it. Now I want to basically direct your attention to one word called happy hypoxia. What is meant by happy hypoxia is, sometimes there can be people in the community walking around, smiling around happy, but their oxygen levels are low. They can go as low as maybe 70, 60, so on and so forth. But they are happily walking around. Why? Because the pathological process is happening in their body, but the symptoms are not happening. When the symptoms start, like shortness of breath start, it's too late. That is why it's so very important to detect that early. Because if you try to start treatment once the oxygen saturation goes down, that means the pathological process has gone too far. That's why it's very important to identify the patients from the community as early as possible, evacuate them and give them early treatment. Early treatment also not very sophisticated. Actually, like I have mentioned previously, it may be necessary to provide oxygen. It may be necessary to provide, say, some steroids at that point.
Right.
but again not in the community. And there are some other simple drugs that need to be provided. So what I am trying to highlight is, rather than trying to think about very sophisticated ICU treatment or very sophisticated drugs that are very expensive,
Right.
if you can follow the simple mechanism like the, say, pulse oximeter, you measure the
So
oxygen
I'll get back to that in a minute. I just want to ask Dr. Rajiv or Professor Indika as to what equipment must you have in a house
Very
in a
simple.
situation of this sort. So I'll come back to all that in a bit. Want to go for a short commercial break. Stay connected. Stay with Face the Nation. We will come back after this short commercial break. Tonight we are discussing about COVID-19, lessons learned and advice for the future. We respect all four panelists who are here in attendance today: Professor Atula Sumidipala, Dr. Rajiv De Silva, Professor Indi Karunatilaka, as well as Dr. Meeru Chandradasa. Despite facing a crisis of this sort, they are still coming on the show tonight to make sure that you, the public, are aware of what's happening around you and to take all safety precautionary measures in a time of dire need. So we will speak about all this and more after the short commercial break. Stay connected, stay with Face the Nation. We will be right back.
COVID-19 සඳහා ආරක්ෂිත පියවර. නිතරම හොඳින් සබන් යොදා දෑත් සෝදන්න. සබන් හෝ විසබීජනාශක මධ්‍යසාරයක් භාවිතා කර දෑත් පිරිසිදු කරන්න. සැම විටම අන් අය සමග මීටරයක දුරස්ථභාවයක් පවත්වා ගන්න. හැකි සෑම විටම නිවසේ රැඳී සිටින්න. නිරතුරුවම නිවැරදිව මුඛාවරණ පළඳින්න.
මහමගට වැටෙන මිනිසුන්ට සවියදුන් දිවිගමනේ බර නිසුල්මනේ දරාගත් මව්වරුන්ට සවියදුන් අමතක කර දැමූ ගමත් නගරයත් වෙනසක් නොමැතිව නගා සිටුවා හදවත් දසදහස් ගණනකින් ආදරය ලබමින්
දී කොටයක් දාලා තමයි අපි මේගොඩ මේගොඩ ගියේ. ඉතින් මේ පාලම සිරසෙන් ඇවිත් දැන් දැක ලොකු ගමට උදව්ව කොහොම ස්ථිති කරනවා ඒ පාලම හදලා දුන්නට නම් වැඩ සටහන යටතේ.
දිනෙන් දින ජනතාව සමග ඉදිරියට යන ගම්මැද්ද රට නගන ජන පවුර.
Welcome back. This is Face the Nation. So I have a question for Dr. Rajiv De Silva. Dr. Rajiv, in a situation of this sort where we are facing a pandemic, what are the basic equipment that an individual can have at an affordable price at his or her home?
I think Indika, you
Yeah, Professor Indika or Dr. Rajiv could.
Okay, thank you. Yeah, I think very simple. Most important is to detect early. So, if you are at home, if you have been, say, contacted or if you are positive and if you are unable to enter a hospital, I mean, there are mechanisms like we have mentioned previously. Even then, there are so many patients at the moment who are not in a position to enter the hospital. So, the very important thing is there are things called red flags. You have to be really on the lookout for the red flags. Because if those are present, for example, if there is shortness of breathing, say on exertion, mild exertion, or while on rest, or when you maybe walk few steps, because the clear instruction that is given to COVID patient is have bed rest, don't try to exert. But even when they are at rest, if they get shortness of breathing, that is a red flag you have to immediately alert. You have to immediately alert health personnel. There are other red flags like, say, persistent severe fever and severe debilitating illness, severe diarrhea, severe vomiting. There are red flags. Actually, what we do during our helpline is we educate them. We educate them. If you have these things, immediately contact these numbers, and then the systems are activated. And the question to answer, the answer is pulse oximeter. If you have this tiny machine actually at home, I'm not asking everyone to go to pharmacies tomorrow and buy it. No, not to do that. But if you have that, that would be very useful.
So let's say someone does not have it. Is there any system in which they can find out? Example, I've seen the Health Promotion Bureau had said just sit on a chair 8 times.
Exactly.
8 times, and then decide if you have breathing difficulties, then you have to consult a doctor immediately.
Very correct. I mean, if you are lucky enough to have a pulse oximeter, again I'm highlighting, please don't go to pharmacies tomorrow and try to buy pulse oximeters, because anyway if you go to the hospital, anyway you will be tested in the pulse oximeter. But answering your question,
how much would it cost, the pulse oximeter?
Is a range actually. Sometimes it can be around 3,000 rupees.
Between 7,500 to 12,000 rupees.
Up to 12. But what matters is not the price. It has to be accurate. If the pulse oximeter can measure up to 99, there will not be any pulse oximeter that can measure up to 100. It's not possible, because that is measured through an infrared system. The maximum probably that you can get is around 99. If the pulse oximeter can measure 99 in a healthy person, that means that is generally reliable.
So I want to get back to Dr. Rajiv Disil about mixing and matching vaccines, because a few months ago, Dr. Rajiv, you said it's okay to mix and match vaccines. Example, with the AstraZeneca vaccine, you can mix a Pfizer, and there is no problem at all, and it may be more effective. We saw the manner in which how Dr. Sandurwan Bandara from the Medical Research Institute, ex member of the Medical Research Institute, was also had mixed and matched, and he got minor symptoms as a result of getting infected with COVID-19. Can you mix and match Xenophon vaccine with any other vaccines?
Yeah.
Because majority of the individuals are now vaccinated with Xenophon.
Yeah. So the data is on mixing and matching Pfizer with AstraZeneca, and the immunologically it is as good or even slightly better than, say for example, 2 Pfizers or 2 AstraZenecas. And now they are doing studies with Moderna as well. Now, there is no data on Xenophon with any other vaccine. So that's the simple question.
Right.
So basically, we will think of mixing and matching. One reason is if there isn't a vaccine. For example, like what happened, AstraZeneca was given 1 dose, but there wasn't a second dose. So then, actually, the ACCD, the Advisory Committee on Communicable Diseases, approved giving a Pfizer, but then of course we got a stock of AstraZeneca. So in such situations, you would think of mixing and matching. You might, I mean, theoretically, you might get a broader response if you mix and match these two, because they give 2 different immunological responses.
Right. I'm going to ask you, today the show has basically been about COVID-19, so we've not asked any political questions, but I'm itching to ask you a political question, Dr. Rajiv, so I'm going to go ahead with it. Association of Medical Specialists, does the government listen to you all?
Well, I must say the government teachers listen to us, right? They were demonstrating, and I think the AMS told them, or sort of requested them to stop, and they did so. I think the AMS, our statements are listened to by the government. They look at it. I don't know whether they respond. I cannot say. But certainly the AMS and I think the SLMA, they were for a lockdown. And after maybe a week or so, the government actually went for a lockdown. So probably they listen to us.
Because there are many organizations when it comes to doctors as well. You have the Government Medical Officers Association, you have the Sri Lanka Medical Association, then you have the Association of Medical Specialists. You have various organizations, but you all have been pressurizing the government to impose a lockdown for some time. And this came after the Mahanayaka Theras of the Malvadu chapter had to write to the president to lock down the country. So I'm trying to figure out, who is the government really listening to?
Unfortunately, I'm not in that particular COVID committee. I think you are there in that committee.
Yeah, but I think even Professor Atula could respond. Who is the government listening to now? Now, Sri Lanka Medical Association, SLMA, has been pressurizing the government to lock down the country. You have the Association of Medical Specialists. Even your chairman has very vociferously said lock down the country immediately. And all these seem to have felt on deaf ears. And the Malvatu chapter chief prelates had to write to the president to lock down the country.
Okay.
Yeah. What?
Okay, I'll answer that. I don't think that may have added to the decision.
No, I am not saying this. This is what Professor Channa Jayasumana said after the president's meeting, Professor Atula.
Maybe, so I mean, I can't answer for the...
I am not privy to the information that is held at the cabinet briefing or the ministers, but I'm just saying the information that is coming out in the media. Why did we wait until the chief prelates of the Malvadu chapter? Well and good, at least they said it and they closed down the country, but that's a different story altogether. But why did we wait?
It's difficult for me to answer that, but because I think all these ads. So if the Minister Channa Jayasumana said that, I can't, say no because he's a politician, I'm not a politician. But the thing is, when it comes to a lockdown, we all know it's a political decision. Because, let me get this right, certain factions who came on streets, as Rajiv mentioned, later were demanding to lock down the country. So it's a political thing which sort of waves. By locking down a country, there are advantages and disadvantages, but by not locking down the country, there are advantages and disadvantages. And as I told you, I mean, we conducted, my research institution, not the Hantani thing, Institute for Research and Development, we took a public poll. 75% said lockdown, 25% said don't lock down. And they had their reasons. So when it comes to the government, they have to make a political decision. Sometimes I personally was for locking down the country. In fact, lot of people were personally was recommending slow release of lockdown in June. But at the end of the day, it's a political decision.
Did that happen? The slow release that you are talking about, did that happen?
Yeah, it happened. It happened a little bit faster than we expected. But there is no, because there are people who argue completely against locking down, not nationally, even internationally. So let me finish, please.
No, I'll give it.
So it's a political decision. Yeah. We may agree. In fact, I heard recently a lot of people own government politicians were for it, against it. Even the government is deciding.
No, then what is the point of having professionals?
I'll tell you, the professional opinion stands, but when it comes to pandemic management, it's not just medical opinion. I'm not saying whether right or wrong. Medical opinion, there are many other straight out the society.
No, I want to interrupt you for a second here, Professor. I want to just pick Dr. Rajiva's brain. Professor Atula is of the view it's not the medical opinion that matter.
No. Don't get me wrong. Medical opinion matters. It's very important.
Then
it's very important.
Okay.
But at the same time, there are other economic reasons as well.
Like what?
People, of course, when you lock down a country, there are economic impacts. Particularly, I think as I understand, people who did not want to lock down the country was talking about a great number of people in this country who are daily wage earners. 65 lakhs, if the figures are right.
So, I'm sorry.
So by locking down...
65 lakhs what? Sorry, I didn't get that. 65 lakhs?
Sorry?
You said something was 65 lakhs.
Yeah.
I didn't get that point.
Yeah, roughly.
65 lakhs of?
Yeah, who earn their daily wage.
Who earn 6.5 million people in Sri Lanka earning the daily wage.
Yeah,
Okay,
so one argument against locking down was that these people will be affected. But as a medical person, the way I look at it, by not locking down the country, when the numbers go up, there is an impact on the economy anyway, because for one ICU bed, for
that's
a day,
understood. Yeah, understood.
We have to spend, health system has to spend 100,000 rupees. Then for a test, 5,000 rupees. So all that adds to the expense.
No, my question was not that, Professor. I think you got it all mixed up. My question was, we have professionals. I respect Professor Atula, I respect Dr. Rajeva, I respect Professor Indika as well as Dr. Muru, and all the medical fraternity in Sri Lanka, I respect them. There is no question about that, because they are the people at the end of the day who come to the front line and look after the public of this country when they are sick or ailing or whatever it is. There is no question about that. My question to you is very simple, Professor. My question to you was, why did the government wait until the chief prelates of the Malbatu chapter write a letter to President Gotabaya Rajapaksa asking him to lock down the country?
How can I answer that? I'm not.
You would just before you said, then we'll park that aside, no, Professor, because
no.
Before when I asked that question from Dr. Rajiv, he said, Shamir, I can't answer this question. Then you took the baton and said, let me answer that question.
No, I was.
Then you're saying that you don't want to answer that question.
There is no black and white answer in this pandemic management.
Absolutely, that is right? Why I asked this question. I want to know why is that the president is waiting to listen to the chief prelates. I'm very sure that none of the chief prelates are doctors. I'm pretty sure about that. So my question was very direct, and you said that you want to answer that question, and then you say that you don't want to answer that question.
No.
It's not fair, because we are just misleading the public. Circles, skirting around the subject, and we are not talking about the real thrust of the matter.
We are doctors.
Let's move on to another subject now, because
we are doctors. When in a doctors forum, we can defend doctors' opinion. Yeah. Right? I was trying to give you the other side of the picture.
You don't have to defend anyone, Professor. There is because you are not representing the government. So if you are representing the government.
Can I come in?
No, let's park that aside, because no point, Professor, skirting around the subject.
Yes. Let's give me a little time, because
okay. Yes.
Okay. So I mean, I'll look at this in a rather broader perspective rather than ask it a simple question, because it's not that simplistic. I'll start with mentioning one thing, that from 2020, when as the president of SLMA, even before COVID came to Sri Lanka, we had the first scientific forum to discuss about COVID, when no one really knew about that. That was a starting point where the professionals in Sri Lanka got to know about COVID.
When was
this? That was actually on 27th of January. That was even before
the first case was
reported. First COVID patient was detected. So about 1,000 doctors attended that conference, either physically or virtually. So that was the first hybrid kind of meeting.
Because 2018 December was 19 December.
In 2020 January 27th, we had that seminar in the SLMA, where over 300 doctors participated in person, and people like Dr. Ananda Vijayvikram and several others, they came in there, Dr. Sudat Samari, so on and so forth, and we discussed. That was the first scientific forum. And from that point onwards, personally, I have worked with everyone who is involved in COVID management, including government, non-government, ministry, health and non-health sector, so on and so forth, during last 2 years. One thing I have seen is, honestly, that I have seen them trying to put their very best at everyone. I'm talking about all the levels, from the highest to the lowest to the grassroots. They are trying to put their very best. That I have seen basically working on one-to-one personal basis with many of them. Having said that, there were areas that have gone wrong right throughout also. And it's not a simple answer. And if you take the 2 years, 2020 and 2021, now the total number of cases that we have seen in 2020 surpassed in one day in 2021. and the total number of deaths that were in 2020 is surpassing one day in 2020. Yeah, let me go on, Shabir. Yeah. So how that this happened? Because now when you look at these figures, now you can see we must have been, as a nation, we must have been doing something correctly in 2020.
Professor Indika, I will buy this argument of yours
Yeah.
if you didn't come on this show before and said the government was doing wrong by not closing down the country.
No.
You've come on this show before and said that.
Let me
and then now, before in your opening remarks, you said, Professor, that there are deficiencies in the process.
Okay, yeah. So what I'm trying to tell.
It's not fair to contradict yourself.
No.
We should not do that.
No, when I mention deficiencies, also I'll come into that also.
Yeah.
When I mean deficiency, I very clearly mentioned this is not to point fingers at anyone. This is not to find blame at anyone, because what we are facing is actually a crisis situation. Crisis situation is something where the normal systems don't work. So the normal system can deviate. That is why we call it crisis situation. Okay, getting back to what I was.
Let me ask you the same question that I asked. Let me ask you the same question that I asked Professor Atula.
Yeah.
So, in a situation of this sort, when there is a global pandemic, and when countries decide their decisions based on professionals like the medical fraternity in their respective countries.
Correct.
Now take a look at Australia for an example. There are street protests being carried out even now as we speak in Melbourne. But the Prime Minister is very steadfast. He says we have to live with COVID, but right now we won't open the country. It's on lockdown. And as a result of that, $5,204 Australian US dollars have been fined from one individual who have who have been attending those protests in question. In a situation of this sort, in a situation of grave concern, in a situation where people are dying as a result of COVID, in a situation where 4,000 infected persons are now reported. Now, based on what you and Professor Atula are saying, you all have spoken 12,000 individuals who have reported.
Correct.
So that means these numbers, as you said before, Professor, it's not been stated properly. So in a situation like that, why did the government wait until the chief prelates, based on what Professor Channa Jayasumana said, I'm basing on what he is saying, wait until he said to close down the country?
Yeah. Oh, actually, you could have got the answer if you have allowed me to go.
I know, but just heard.
No. Please allow me.
I will.
Yeah. Because I mean, and without disturbance, because I need to explain this very clearly.
Yeah.
So if you take 2020 and 2021, there is a difference. And in 2020, actually, the situation was controlled very much. If you take up to September, there were no waves actually. There were individual clusters here and there. Situation was very clearly controlled, and public health measures, they were implemented. So we must have been doing something wrong, something correct in 2020, and something must have gone somewhere wrong in 2021, or maybe deviated. Say, rather than saying wrong, maybe deviated. I will be telling few things in my experience during last 2 years, few things that have been done very well, and few things that probably might have deviated. With that sequence of events, you might get a clearer idea. Now, I mentioned about that January event. No, then another very good thing that happened later was in March. In March, Ministry of Health called for a meeting of all the professional colleges. That was in March, and they asked for the first time, what do you think? Then all the professional colleges, they responded and saying, at this moment, you need to close down the country. And at that point, the Minister of Health was not very supportive of that, but after the professionals basically pressed on that, then the minister and the ministry agreed. Then after that, you may remember there was a long lockdown, and during that period, the patient numbers were less. So that was one decision. What I am telling is not about the lockdown, but the Ministry of Health deciding to listen to experts outside the ministry, and actually there was a body called technical body, the technical committee of the Ministry of Health, that was formed, and that had all the experts related to the COVID. So during last 2020, every time that committee was meeting every month, And all the experts, all the specialties like surgery, medicine, and then general pediatrics, all the specialties colleges come in there and providing advices, and ministry officials are taking that. That might have been one reason. So this is a very good example of health leaders or the health professionals taking lead. That is one very good thing that has happened. And later, then in April, at that time there was a big controversy about what should be the best test that you should be using to diagnose. And
April this year?
Yeah.
Is it April this year?
April 2020. There was a huge, last year. There was a huge controversy. What should be the testing policy of the country? And many people were pushing for antibodies. At that time, SLMA, College of Physicians and College of Microbiologists came together, issued a very strong statement that RT-PCR should be the diagnostic. And the ministry.
I remember that you want testing at that time as well.
That's the second thing I am talking about. So that was second good decision. And later in this year, when the surge was coming, again there was a meeting organized by OPA where Professor Malik Piris explained very clearly why there should be at least 4 weeks lockdown. So again, that decision was taken. So I am highlighting 3 instances where...
No, I am not talking about any of these instances.
Give me,
I am not talking about any of these instances.
Samir, please let me finish this.
Yeah.
So...
I am not talking about any of these
please, otherwise you are disturbing my flow, Samir.
Yeah, okay.
So there are 3 instances where very clearly the government listened to the professionals. I am giving 3 examples. Then I will be giving you 3 areas where this might have been deviated. Now take September. There were a lot of promotion about unethical, say, treatment methods, so those tiny and all these things. There's a lot of promotion on different angles. And that time, actually that could have been the time the country should have been prepared for vaccination. And knows, please let me finish. Country should have been prepared for vaccination and also towards the preventive measures. That's one instance, number one. Then also take 2000, then after that, again there was slight relaxation, and in September, another surge came up because what we should not be doing is keeping our foot away from the pedal. So some relaxation happened, and in September there was another surge coming up. And then, number 3 I am talking about is in February. In February, everyone knew what was going to happen.
February this year?
February this year, because everyone knew what was going to happen. At that time, the emergence of Alpha variant was also known, and the UK variant was also known to all the professionals. Having said that, actually at that time, I haven't really seen any professional organization putting adequate pressure to bring in travel restrictions during that time period. So honestly, I am not putting the blame only on the government. I am putting the blame on all of us as a nation.
All stakeholders.
There have been several mistakes that have gone. So at that time, if in February, if the travel restrictions were brought in during New Year, now I am bringing the comparison between the 2020 April, where the professionals unanimously closed around the country, and the ministry heard. But in 2021 February, when the Alpha variant was emerging, no one really pressed. Now, at that time, professionals knew. Professionals and scientists knew the Alpha variant was coming, UK variant was coming, but it was not there. So, that's one. Another error is, now in the 2020, what we have seen is the technical committees, the government was listening to the experts. But later, it was more towards listening to the trade union leaders. Now again, don't get me wrong, I am not blaming any trade union. I am also a trade unions in the Teachers Association. Trade unions should be there. They should be there in COVID also because they have the largest workforce. But giving the dominance to the trade union leaders can lead to deviation. That's also very dangerous because, being trade union, that's not their fault. The trade unions should get dominance at any time. So that's another thing. They have to play their role, but giving the dominance is a problem. So what I am saying is a combination of all these factors coming in, where the health sector and the experts should have taken the lead like in 2020, hasn't happened in that way in 2021, and there was a vacuum, and that vacuum has been filled by different categories. That's possible because when there's a vacuum, that will happen. So
Thank you. Yeah.
it's a very complex issue.
So anyway, just a very quick remark, Tarush, if you don't mind, please. So whatever you said, Professor, I leave the public to decide as to what is right and what is wrong.
Yeah.
But the fact remains, what Professor Chandra Jayasumana said, that the lockdown was imposed on Friday after giving adherence to the views expressed by the Mahanayaka Theras of the Untitled Chapter. That remains. That won't go off if you, however much you try to do it. So, yeah.
Professor, I listened to everything that you said.
But before that, can you tell the public about the call you received from the...
No, I'll get back to that. I'll get back to that. Also, Professor Atula, after before the end of the show, I'll let you know about I sent a message to that number as well. Sharon sent a message to that number as well. So I sent the message at right after Sharon received the call, because Sharon is a very famous guy, so a lot of people know Sharon's number. But my number is not known to a lot of people. So I sent the message at 23:09. That's at I've not got a call yet. So that's where it stands. So I didn't want to talk about it because you brought the issue up. I just mentioned that because that's very important for us to educate the public in the right trajectory. Yes, Harusha.
I was actually going to ask a question from Professor Indika, but let me just deviate my attention to Dr. Rajiv De Silva now. Talking about this booster shot, this third dose of the vaccine once again, the President said that by the end of this year, most of the population will be fully vaccinated. Like, let's hypothetically assume that by in the middle or in the first few months of next year that we are fully vaccinated. Hypothetically, if the virus raises its head again, do you recommend that we should go for a booster shot, a third dose of the virus, because we now see that Israel is doing it?
Yeah, so once again, I have to say that there are two types of vaccines once again. We have the three vaccines, AstraZeneca, Pfizer and Moderna, about which we have data. So as of now, up to 6 months, we don't think that you need a booster to improve immunogenicity to prevent deaths. Whether these boosters would reduce mild infections, we are not sure. We know that when you give a booster at 6 months, or with the Pfizer about 8 months after the second dose, you get an increase in the antibody responses. We get an increase in various other things in the immune system. Whether that is going to last for a long time, we don't know. So basically at the moment, we don't know. So if, for example, we get information, okay, if you give a booster, say, for example, we find that the immunity is going down and people are getting sick, really sick, then definitely we would need a booster. We will know, obviously, after 6 months, people will be getting mild infections. So we need some data to see, when you give this vaccine, whether those mild infections also disappear. So that we will get data with the Pfizer in Israel, data from Israel. So what I am saying is, we need data. Without data, we can't say, okay, this year we will give the vaccine and so on. And the other thing which I think, what I said earlier was, we might get into a situation like we have given the vaccine, 2 doses to everyone, and because this virus will be circulating for a long time, people will be getting infected, and you will get natural boosting of immunity. And because it's the entire virus, and you will get immunity not only inside the body but in the mucosa. Now with this vaccine, right, you get some kind of immunity, but you don't get a lot of immunity in the places that this virus enters, for example, the nose and the upper respiratory tract. So that's why when you give this vaccine, people still get infected. People still can get colds and coughs. Whereas if people get infected, mild infections, you might get protection from this area as well, and you will probably see a reduction in even mild disease.
Dr.
Rajiva, yeah,
if I can just
yes.
pose one question. Dr. Rajiva, you just highlighted the importance of data, and I believe in the opening round as well, Professor Indika, Professor Atula, all highlighted the importance of data and the data flow. There were some concerning reports the past few days where the cloud system of the National Medicines Regulatory Authority, which is the authority that, of course, grants registrations, approvals, renews registrations for drugs, medical equipment in Sri Lanka, was just lost, completely wiped clean. And the explanation, at least from the responsible factions at the NMRA, was, well, less than satisfactory, to say the very least. They said that an employee of a private company who was supposed to upload the data on behalf of the NMRA had mistakenly deleted all the data. How fatal is this to the COVID-19 process here in Sri Lanka, and also the rest of the other medicines that are brought into Sri Lanka? How will this affect? As a member of the profession, as a senior member of the profession, is this an unprecedented event? How much of an effect will it have on our health system that is already strained to its extreme?
Well, of course, this is an unprecedented situation. I don't think it has ever happened in Sri Lanka. Now, I think one problem would be there are sort of very confidential data in that. And I understand that some companies, I'm talking about the principals, might be a bit reluctant maybe to give confidential data to the NMRA.
Now that the information has been compromised?
Well, we don't know what has happened. I mean, if it has been deleted, then of course no one is going to get that data. So we don't know. So till we get to know what has happened, well, I think some of their agents here have said that some people, some of the principals might be a bit reluctant to give confidential information.
Very quickly, Dr. Rajiva, before I go to the final round, can someone who has got COVID get reinfected?
Yes, of course.
What's the time period?
We don't know. Maybe after 6 months.
After 6 months.
Yeah, but people have got, I mean, just like after vaccines, I mean, people have got infected.
Jamir, if I can just pose one more question to Professor Atula.
No, I'm going to close it now. So I want to go into the final round. So let's start off with your message to the government as well as the key stakeholders in terms of combating COVID-19. So let's start off with Dr. Meru Chandradasa, consultant child and adolescent psychiatrist, Ragama Teaching Hospital. Yes.
So the first thing is we have to come to some resolution and solution to the teachers' union strike and to start the online education back up. Then we have to look into the mental health of young people, children and adolescents, because it's very important, because if not, the effects of this pandemic will last for many decades to come. So all parties concerned need to consider this is extraordinary times and they need to maybe take a step forward to come to reconciliation and to help the kids and young people achieve some education during this difficult time.
Right, thank you very much. I now move my attention to Professor Atula Subbatipala, Chairman, National Institute of Fundamental Studies and Emeritus Professor of Psychiatry, University of Kiel, UK.
Yeah, I think for me, my message is this is not a time to try and see who is wrong, but to think collectively what we can do differently for a better outcome. Everybody starting from politicians, professionals, the public, trade unions, everybody should be held responsible to do it right. This is a time to unite, not a time to divide. And I totally agree with Muro. We are talking about a generation gap education. For me, as much as trying to save the lives of people, it's very important to try and save the right for education for our kids. So my plea, particularly to the teachers, get back to the job. My plea to the government, try and sort it. It's very hard to solve a problem which had been there for 27 years within few months, but we need to unite and face this challenge.
Right, thank you very much. I now move my attention to Dr. Rajiv De Silva, immunologist, media spokesperson of the Association of Medical Specialists.
Yeah, my sort of advice to politicians as well as the professionals is to be scientific. Look at the data and make rational, logical and scientific decisions. Whom to immunize, booster, lockdown, in all these, instead of being sometimes irrational, sometimes going on gut instincts, go rationally and scientifically, and probably we might do a better job.
Right. Thank you very much, Dr. Rajiv De Silva. Professor Indi Karunathilaka, former president of the Sri Lanka Medical Association.
Yeah, thank you. I think the first step in managing any crisis or any problem is recognizing that there is a problem. Do we have a problem at the moment? Yes. There is the possibility of the health system being overwhelmed, and there is a possibility of wave of deaths coming following this wave of patients. And at this moment, there is no point of finding out who is wrong, but it would be very useful to see what is wrong rather than who is wrong, what is wrong, or where we have deviated and learned from mistakes. That's very, very important. And regarding the immediate issues, regarding the prevention of deaths becomes a priority at this moment. Therefore, immediate identification and evacuation and early management of patient is important. There need to be mechanisms. And when it comes to mechanisms, the mechanisms will not be perfect. They are evolving and they need to develop within a very short time. And what we have to do is to work together. Everyone needs to work together, because the definition of the crisis or a disaster is a situation that where the normal functions don't work in the same way. So you cannot expect perfection. And since it's a disaster situation, you need the help from everyone. So this is the time for us to come together, everyone to come together and work towards the common goal. At the moment, the common priority is we have to save lives, nothing else. We have to save lives. Yes, we have to prevent and stop the epidemic. Yes, we need to. What we need to do with this at the moment is, during this time period, during the lockdown period, we have to work on and develop systems in such a way, put the systems in place during this time period, because we should not be expecting during this lockdown period the epidemic will go down. The time period may not be adequate, but we should be able to develop our systems during this period. We have to make use of this time period for us to come together, learn from mistakes, develop systems and put them in place.
Thank you very much, Professor Indi Karunathilaka. Thank you very much, Professor Atul Sumantipala, Dr. Rajiv De Silva, Professor Indi Karunathilaka, as well as Dr. Mayuri Chandradasa for joining us this evening on the show. It's very, very important, very, very imperative to keep our viewers up to date on what's happening around them as far as battling COVID-19 was concerned, and that was our effort today to make sure that we spoke about this subject. We've been doing this over the last few months, last few years, to keep you aware of what's happening around you and to take precautionary measures. That is why we've invited the usual players that we usually have on the show to keep you abreast. Thank you very much. Salute to all four of you. All four of you are in the front line. And thank you very much for joining us this evening, and despite the fact your demanding schedules and coming on the show and keeping our viewers abreast. Thank you very much, Lost on Shahan Benji. I'm sorry, Shahan, I had to cut you off because
no problem.
I have to finish the show before 12 midnight. Thank you very much, Deshan, and also Tarusha Kumar Singh for joining us this evening on the show. I leave you tonight, as I always do, with the world famous quote, "Prevention is better than cure." Take care and good night.